Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Welcome, everyone. My name is Lauren. I'm the Program Director with Cancer Support Community. Today, we have an awesome nutrition seminar presented by Blair, and Blair will be sharing how to optimize bone health through nutrition. Thank you, Blair, and I'm turning it over to you.
Thank you, Lauren, and welcome everybody to Optimizing Bone Health Through Nutrition. This subject is particularly important in the context of healthy aging, and also because many of you may have had cancer treatment that could affect bone health. So we're going to go ahead and dive in and get started. So a little background, why do we even need healthy bones? What are the functions of our bones? So our bones provide structural support. So they form the framework that shapes and supports our body. It's also responsible for protecting vital organs. So that's our brain, heart, lungs, by encasing them in bone structures like our skull and our rib cage. It's responsible for anchoring muscles, so serving as attachment points that facilitate movement when our muscles contract. And also this is where the nutrition part comes in, but storing those essential minerals. So our bones are literally made up of calcium and phosphorus. So they contribute to bone strength and they're released into the bloodstream as needed. And so if our blood levels don't have enough calcium, it will leach calcium out of our bones into the blood. So when the body does need calcium and it breaks down and needs to rebuild bone, that's called remodeling. And we'll talk about that a little bit more on the next slide. So our bones are not a static structure. It's dynamic. They change and develop throughout the course of our lives. Bone remodeling is a process by which new bone is formed while old bone is broken down and removed. So I'm going to take you back to anatomy and physiology here. Osteoblasts are the cells that are responsible for forming new bone, and osteoclasts break down and resorb old or damaged bone tissue. So this process is just going to help in repairing any type of micro damage that we have through just our general daily activities. And then as we adapt to physical stress, and then also to regulate, again, the calcium levels in our blood. So in our younger years, childhood and adolescence, our bodies focus on building bone mass. Bone formation is what's going to be happening more rapidly than bone resorption. And so as a result, individuals in these life stages are going to gain bone mass. And this is a crucial period for building strong, dense bones that are going to support us throughout our lifetime. So peak bone mass, it's typically reached around anytime between the ages of 30 and 35. And this is the point where bones have reached their maximum strength and density. So you're not going to keep developing bone mass after this point. So later years, adult year and beyond, the balance between bone formation and breakdown is going to shift. So at this point, your body's going to begin to break down bone slightly faster than it can rebuild it. And this natural decline in bone mass is just a part of the aging process, but it is influenced by factors such as hormonal changes, and this is going to happen more frequently in postmenopausal women. Also, nutrition, and then perhaps decline in physical activity. Genetics and underlying health conditions can also influence bone mass. So the amount of bone mass built early in life is going to play a significant role in long-term skeletal health. And individuals that had a higher peak bone mass to begin with are going to have a larger bone bank to draw from as they age, and that's going to just reduce their risk of osteoporosis and osteopenia as they get older. So speaking of osteoporosis, we're going to go ahead and define that now. So it literally means porous bone, and it's a progressive condition characterized by a decrease in bone density and structural deterioration of bone tissue, which can lead to fragile bones, which are susceptible to fractures. So our healthy bone looks kind of like a honeycomb, but in osteoporosis, the honeycomb spaces tend to become larger, and that in turn makes the bone weaker and a little bit more brittle. So as a result of this, even minor stresses, so like a fall or bending over or even coughing, can cause fractures. So one of the most noticeable aspects of osteoporosis is it's often asymptomatic or developed without any noticeable symptoms. And people may not even know that they have osteoporosis until they experience a fracture, thus the importance of building up strong bones prior to this happening. So a lot of the common sites where this might occur, the fractures may be the hip, the wrist, or the spine. And unfortunately, that's going to severely impact mobility and quality of life. Approximately 54 million Americans, that's a lot, have osteoporosis. The condition does affect men and women, but women are more likely to develop it than men. As you see here on the slide, 1 in 2 women will develop osteoporosis in their lifetime, as opposed to only 1 in 4 men. So a little bit more on that, as I mentioned before, it's usually pretty asymptomatic, but if any symptoms do occur, it may be loss of height, change in posture. So if you notice yourself bending forward a little bit or stooping, not able to stand up quite as well, that may be an indicator. Shortness of breath could be due to many things, but one factor could be compressed discs. Obviously, bone fractures, as we mentioned, that's going to be a huge indicator. And then frequent pain in the lower back can also be indicative. So any factors affecting bone health, there are many. We're going to go over some of them here. A diet low in calcium intake can contribute to diminished bone density and early bone loss. Physical activity. So if you have a history of being physically inactive, that can lead to increased risk of osteoporosis, particularly if you haven't been doing or haven't done any weight-bearing exercises. Any type of substance use, so tobacco and alcohol use, can weaken bones. I'm going to mention this a little bit later on in a different slide, but for cancer prevention, we recommend no alcohol, none whatsoever. There actually is no safe level, as I'll mention later. But if you are going to choose to drink, greater than 1 beverage per day for women and greater than 2 a day per men can definitely increase that osteoporosis risk. And then, as I mentioned in the last slide, women are at greater risk than men for developing osteoporosis. So additional factors, if you have a smaller body frame to begin with, or a BMI, which is a body mass index of 19 or less, you are going to be more likely to have osteoporosis and an increased risk for stress fractures. Again, our bones become more brittle and thinner as we age. If you have a family history, if you have a parent or sibling who has osteoporosis, for example, my mom is only 66 and she's had osteopenia, developed an osteoporosis since she was about 60. And so I know personally that I have to be wary of my bone density and my calcium intake and physical activity. Also, I mentioned hormone levels. So too much thyroid hormone can lead to bone loss. Women experience decreased estrogen levels, particularly in menopause, so that can lead to bone loss. And then men, hormonally speaking, lower testosterone levels can lead to bone loss. Also, history of eating disorders or other types of conditions. So if you restricted your food intake for a period of time, and then, of course, being underweight weakens bone and can lead to osteoporosis. Weight loss surgery and conditions like celiac disease can affect your body's ability to absorb calcium. Also, it's not mentioned on this slide, but partial and total gastrectomies are going to affect your body's ability to absorb calcium, so that can affect bone health. Different medications, so long-term corticosteroid therapy, so dexamethasone, prednisone, cortisone, as well as aromatase inhibitors that are used to treat breast cancer, can put patients at increased risk of osteoporosis. Some selective serotonin reuptake inhibitors, so that's antidepressants, anti-anxiety medications, can affect bone health, as well as methotrexate, Dilantin, and phenobarbital, so those anti-seizure medications, as well as proton pump inhibitors can affect bone health. So let's talk about cancer survivors specific to bone health. Cancer survivors are going to be at higher risk for bone loss and osteoporosis in the general public. And once again, that's often due to the cancer therapies in and of themselves. Breast and prostate cancer treatment may cause lower estrogen or androgen levels, which are two hormones that are important for strong bones. And it's specifically multiple myeloma patients, it is estimated that 75% of this population have osteopenia or osteoporosis. Osteoporosis is a recognized complication of HCT or hematopoietic cell transplantation, and that prevalence is as high as 50% as early as 1 year after transplantation. And then lastly, if you've had GI cancer, had surgical intervention that involved the duodenum, that duodenum is the primary absorption site for calcium. And so any surgical interventions that are bypassing or removing the duodenum can increase the likelihood of bone loss, and bone density should be monitored. So how do we screen and how do we monitor for this? Some of you may have already had this done, but to monitor for bone mineral density, dual energy X-ray absorptiometry, so the DEXA scan is a good way to monitor your BMD, your bone mineral density. So these X-rays are just going to use a small amount of radiation to determine how solid the bones of the spine, hip, or wrists are. Regular X-rays are only going to show osteoporosis if the disease is very far progressed. So that's why DEXA scans are recommended. So all women over the age of 65 should have a bone density test. But if you have other risk factors, if you've gone through treatment, if you have family history, things of that nature, it may be recommended that you get tested at a younger age. And the same goes for men age 70 and older. If risk factors are present, you're going to want to get a DEXA scan earlier on. All right, so let's talk a little bit about osteopenia versus osteoporosis. These are the results from a bone mineral density test below. The definition of osteopenia is just the thinning of bone and characterized by a low bone density. So we call that a T-score. And so you'll see on this bone density test T-score below. Anything between -1 and 2.5 is going to be defined as osteopenia. And then if your result is less than -2.5 T-score, that's going to be indicative of osteoporosis. All right, so we've talked a lot about what osteoporosis is, how to not have healthy bones. So now we're going to talk about how do we keep our bones healthy? How do we make sure that our bones are strong? So first and foremost, we want to make sure that we are including adequate calcium and adequate vitamin D in your diet, that you're including physical activity in your daily routine. I have another slide on exercise later on, but that's specific to weight-bearing exercises. Definitely speak with your physician or physical therapist prior to starting any kind of exercise routine, particularly weight-bearing exercise if you have not been doing them. But lifting weights a couple of times a week, walking, jogging, climbing stairs, anything where you're using your own body weight can be helpful. There's resistance bands out there, balance exercises that can help with bone density. As I mentioned before, avoiding substance abuse. So if you don't smoke, don't start. And if you are smoking, then we have a smoking cessation program at Northside, and there's plenty of programs out there that can help you stop smoking. Avoiding alcohol is best, or limiting if you are drinking. So let's talk calcium. How much do we need? So adults 90 through to age 50 need about 1,000 milligrams a day. And if you are a male up until age 70, 1,000 milligrams a day. But you'll see at the bottom of the slide, that number does go up to 1,200 milligrams a day for women 51 and older, as well as men 71 and older. So it does increase. So remember these numbers. If you're a woman 51 and older, around 1,200, 71 and older, 1,200, 1,000 otherwise. So you'll see here, these are the food sources and the approximate amount of calcium per serving. So 1 cup of milk, or cup of fat-free or low-fat yogurt, calcium fortified soy or rice milk, calcium fortified orange juice, and then low-fat cheese, about 1.5 ounces. That's going to be about 300 milligrams per day. And if we do our math and you know that you need 1,200, you would need approximately 3 to 4 servings of these types of foods. You'll see below that there are other options to incorporate because I don't think many of us are doing 4 cups of milk a day or even 2 cups of milk and 2 cups of yogurt. So you'll see that salmon, sardines, calcium fortified cereal is also going to be a good source at 200, as well as calcium fortified bread, cottage cheese around 150. And then good snacks, frozen yogurt, almonds, a fourth a cup of almonds is going to give you about 100 milligrams. And then you throw in orange, broccoli, can just add to that a little bit. So those are going to be the main sources that you're going to want to consume to try to get that 1,000 to 1,200 milligrams a day. So if you want an actual calculator to help you figure out how much you're getting in, www.bonehealthandosteoporosis.org does have a Healthy Bones Guide calcium intake calculator. As you'll see here, it'll have the primary sources of calcium. It'll multiply that by the number of servings you have per day, and it lists the serving sizes next to the food or beverage product. And then it accounts for about 250 milligrams a day from other sources. So that's going to be like your oranges, your broccoli, things like that. And then that'll let you know whether or not you are meeting your RDA for calcium. So again, like I said, a lot of us are not getting in that 1,000 to 1,200 milligrams a day, particularly if you have risk factors or if you're on certain types of medications. A lot of people do have to supplement. And you've heard me in my other talks talk about how we don't necessarily recommend supplements unless there is a need. And in many cases for calcium, there is a need to supplement. So you're going to see 2 common forms when you're in the store and looking at different types of calcium. So the first one is called calcium carbonate, and this is the type of supplement that you need to take with food. Okay, so I'm going to give you a few examples. So if you're taking any of these, then you would need to take them with food. So that's going to be your Caltrate, Tums, Viactive, or Oscal. All of those need to be taken with food. So calcium citrate does absorb a little bit better into your system. It does not require food. So Citracal is an example of calcium citrate that you could take without food. Pure Encapsulations also has calcium citrate that you can take without food. And this is not on the slide, but when calcium is taken with a source of vitamin C, so your citrus fruits, strawberries, things like that, that's going to increase absorption. So vitamin C, again, your citrus fruits, strawberries, spinach, that's going to increase the absorption of calcium. Okay. So you are going to want to take that 2 hours apart from iron, because calcium and iron, and I'm sorry, the vitamin C helps with iron absorption, not calcium. I needed to correct myself. Lauren, if you can edit that out. So iron and calcium compete for absorption. And so if you are a little bit lower in iron, calcium citrate may be a better option for you because that does not need to be taken with food. Or you want to make sure that you're taking an iron supplement 2 hours apart from your calcium carbonate. So it's going to be best absorbed in smaller doses, so less than 500 milligrams. So that's about half your need per day. And if you meet with your physician or dietitian and they want you to take, say, 1,000 milligrams of supplementation, you may just have to divide that into taking 1 dose in the morning and then 1 in the evening. It's available in multiple forms, so you can find calcium supplementation in tablets, in chews, liquids, or powders. No supplementation is regulated by the FDA, just so you know. More is not always better, and so you don't necessarily, if you're already meeting the goal, the 1,000 or the 1,200 milligrams a day, excessive calcium is not going to necessarily provide you extra bone protection. So that's our goal, is just to reach that 1,000 to 1,200 milligrams. And it is important to always tell either your dietitian or your doctor, or your healthcare provider, that you are taking calcium or whatever supplement it may be, because supplements can potentially interact with certain medications. All right, so moving along to another important nutrient is vitamin D. So vitamin D is unique in that it is a nutrient that we eat and a hormone that our bodies produce. It's a fat-soluble vitamin, so it does absorb better if you consume with a meal with fat in it. Its key function is to help our body absorb that calcium, and it is crucial for bone health. So there's two forms, there's vitamin D2 and vitamin D3, but the main source is not going to be our food, it's actually going to be sunlight exposure. So how much vitamin D do you need? You'll see it increases as you get older. It's not milligrams, it's going to be international units or IUs. 70 plus is going to be 800 IUs, and then age 1 to 70 is going to be 600. And then the amount is quite different for a baby. So particularly older patients or patients that have had cancer treatment, it is good and beneficial to have your vitamin D levels checked just to ensure that you don't need supplementation. If you do, it's absolutely fine. Daily vitamin D supplementation may look like 1,000 IUs a day, but there's also shots available at around 50,000 IUs that may be given just at whatever frequency your doctor recommends. It may be just once every couple months or a few months. There are some food sources. Again, there's not a ton. Our main source is going to be 10 minutes of sunlight a day. But oily fish like salmon or trout, sardines, or canned tuna is going to be a good source. Any type of mushrooms that are exposed to UV light is gonna give you some vitamin D. Because it's not necessarily naturally occurring, there are fortified foods. If you look at your milk label, orange juice or yogurt, a lot of times they're going to have vitamin D added to it to aid in absorbing the calcium that's in that food or beverage product. So those are the main nutrients, but there are other nutrients that are important in bone health. Protein, you're going to hear a lot more about protein at my next talk. But that's also very important for bones, so I'm going to go ahead and bring it up now. Protein makes up 50% of our bone volume, so it's very important. And once upon a time, you may have heard this, that high protein diets were thought to leach calcium from bones, but now they are thought to play a very important role in bone building. The next nutrient is magnesium, so that's a mineral that is involved in the laying down of bone. And the RDA is going to be 310 to 420 milligrams a day. And some good sources of magnesium are listed here on the slide: pumpkin seeds, almonds, spinach, cashews, peanuts, black beans, and edamame. Other vitamins and minerals, potassium is one of those listed here. Higher dietary potassium intake is positively associated with higher bone density in older adults and in postmenopausal women. More research is needed in order to support the role in bone health. Sources of potassium are going to be fruits, vegetables, beans, dairy products, as well as potatoes. And then zinc is going to be necessary for renewal of bone tissue and mineralization. And some sources of zinc are poultry, whole grain cereals, legumes, and dried fruits. But in order to get all of these vitamins, minerals, and protein, we just want to focus on getting a balanced diet with all macro and micronutrients. So again, just to expound upon protein and bone health, many adults do not get enough protein in their diet, which may be harmful for bone health. I get asked all the time, how much protein do I need to be eating? And that is going to depend on many factors: your height, your weight, your activity level. If you have anything else going on in your body, for example, if you have altered kidney function, you may need a little bit less protein. If you have cancer, you probably need more protein than just a normal healthy adult would need. And so it just depends. So I would recommend talking to a dietitian to figure out about how much you need. It does slow down bone loss and reduces the risk of hip fracture as long as you're having enough calcium. Good sources of protein is going to be your leaner meats, poultry, fish, eggs, and dairy. Plant sources of proteins are beans, lentils, tofus, and nuts. Also, there's protein supplements, so protein powder, protein shakes, things of that nature. And then lastly on this slide, you'll see that beans or legumes are listed, which they do contain protein, but they also contain something called phytates, which can reduce calcium absorption. So what you want to do is soak your beans in water for several hours prior to cooking, and then you're going to want to pour off the water that you soaked the beans in prior to cooking, and that's going to help to leach some of the phytates out. Vitamin K2, you may have heard of this. This is becoming a little bit more known. Vitamin K2 deficiency is more prevalent and potentially linked to heart and bone health. Serum levels aren't reliable for testing. As far as bone health is concerned, vitamin K2 activates a protein produced by the osteoblast, which is called osteocalcin, and that's going to draw calcium into your bones. And then for heart health, just a little side note, fun fact, it also activates the matrix GLA protein, which helps prevent buildup in the arteries and soft tissues. So here's some sources here. You'll look to the far right, the column that says vitamin K2. Again, the role is proper calcium utilization, and some of the food sources are going to be liver, meat, egg yolks, higher fat dairy, and something called natto. I don't know if y'all are familiar with that, but it's fermented soybeans and it's Japanese. So that's the vegetarian option. There, at this point, there is no DRI, dietary recommended intake. So we are not sure how much you need, but just making sure to get in a lot of those food products is going to be helpful to ensure that you have adequate vitamin K2. Physical activity, very, very important for our bones and for multiple aspects of our health. It is recommended that we get approximately 150 minutes of moderate intensity physical activity per week. And so that would be 30 minutes per day, 5 days a week. You could go ahead and get that in. And then, like I mentioned before, just making sure that you're incorporating some type of weight-bearing exercise or use of resistant bands 2 days a week. As far as moderate activity is concerned, walking, slow jogging, any type of slower resistance training, yoga, Pilates, that's going to be moderate. If you're more of a HIIT person or you like to do sprints or things like that, it's recommended that you have 75 minutes of that activity level. So the more intense training weekly for your physical activity. And so I know I've also spoken about this on some of the talks. Sometimes people say, well, I can't get in the recommended 10,000 steps a day, so I'm just not going to try. I don't know where the number 10,000, who came up with that. That's not a thing. That's not necessarily research backed. So starting small, if you're able to walk and right now you're getting in 3,000 steps a day, let's bump it up to 5,000. Let's space it out throughout the day if we need to. So say you walk 10 minutes in the morning, 10 minutes at lunch, and then after dinner you walk 10 minutes. You've gotten in your 30 minutes a day. You can park further away from the grocery store and just try to increase your steps a little bit. Or you can take the steps, if steps are available as opposed to an elevator. So starting small, starting somewhere, and then just gradually increasing that activity level is going to be very helpful for you. I also have a watch that yells at me whenever I sit for too long. And so that can be helpful, just reminding me every hour that I need to stand up and walk around a little bit, particularly if you have a sedentary job where you're on the computer frequently. It's just good to, every hour on the hour, just stand up, stretch, walk a little bit. Also limiting screen time. So that's anytime, you really can't help how much you have to be on a screen at work. But anytime it's within your control, trying to not use watch YouTube too much or use your phones, look too much at social media or even watching TV, try to limit that to less than 2 hours per day as much as possible. So again, limiting or avoiding alcohol consumption, both for bone health and cancer prevention, is very important. We used to say that a little bit of wine could be helpful, but now it is noted and research shows that there is no healthy or protective level of alcohol, particularly in the context of cancer prevention. So it is best to avoid if in all possible, because alcohol in any form and any amount is considered to be a potent carcinogen. Smoking cessation, like I mentioned earlier, we do have classes in Northside. If you're not in the Northside system, talk to your doctor and ask to be referred to a smoking cessation program. There's the phone number there if you want to call and get a little bit more information, or you can email smokingcessation@northside.com to get a little bit more information about that. So sometimes calcium and vitamin D may not be enough, so treatment may be warranted. And sometimes it may include preventative measures. But several classes of medications that are available are hormone and hormone-related therapy, as well as bisphosphonates like Boniva, Reclast, biologics like Prolia, and also anabolic agents. So in summary, what can you do from your standpoint? Again, like I mentioned before, just consuming a balanced diet, getting in enough calcium, vitamin D, protein, magnesium, vitamin K. From a lifestyle perspective, making sure that you're exercising, getting in weight-bearing exercise as you are able to do so, participating in resistance or balance exercises, walking, jogging, running, biking, whatever you are willing to do or can do, limiting or avoiding alcohol, refraining from smoking, and then just make sure that you're getting your DEXA scans as well so you know where you stand.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.